Hello, I am Rua Williams. I'm an assistant professor at Purdue University in user experience design. I am a social science research council Just Tech fellow. And this is Only the Old and Sick Will Die, Reproducing Eugenic Visuality in COVID-19 Data Visualization. Quote, these are people who were unwell to begin with, end quote. CDC Director Rochelle Walensky, January 7th, 2022. 2 years into the global coronavirus crisis, CDC Director Rochelle Walensky appeared on Good Morning America to discuss the latest COVID news. When asked about a recent study of vaccine effectiveness, Walensky remarked that the overwhelming majority of deaths occurring in vaccinated people were those with, quote, at least 4 comorbidities, end quote. And thus the results were, quote, really encouraging. Walensky was publicly criticized for her remarks by disability advocates for the way her words undervalued disabled people's lives. Walensky and the CDC pushed back, claiming the TV interview omitted crucial context, namely that Walensky was specifically discussing vaccine effectiveness and not making commentary on the value of lives lost. Defenders of Walensky fared to reckon with the material and moral consequences of a society that looks to data showing a disproportionate impact on a vulnerable group and declares it encouraging. Amanda Reyes describes eugenic visuality as practices of looking, ways of seeing, or the dialectical interactions between visual representation and interpretation that reinforce and sustain eugenic policy, politic, and thought. She concisely examines bell curve visualizations as a way of constructing and legitimating racial hierarchies in educational law and reproductive policy. Through classifications predicated on white supremacist logic and through data collection fraught with white supremacist common sense, the objective data behind the histogram justifies white supremacist interpretations, conclusions, and solutions. Assertions that racism is an individual attitudinal problem elide the historical and contemporary determinants of the color line and its material and embodied effects. Eugenic visuality manifests data representations and interpretations that, for example, portray the effects of poverty as the causes of poverty, or the effects of racism on health as the causes of racist disparities in health outcomes. While many people imagine eugenics as a historical social movement that is now defunct, critical scholars of disability and race recognize the persistence of eugenic thought in social policy and research. Eugenic ideals about which lives are worthy of life and which bodies are compelled to seek cure are embedded in biomedical research, assistive technology, and in human rights policies themselves. In prior work, I have argued that the explicit eugenics movement has transformed into a meta-rhetorical logic, meta-eugenics, that naturalizes and normalizes a widespread compulsion to fix, hide, or cull any body that challenges eugenic norms of health, wellness, productivity, and value. This meta-eugenic logic undergirds public policies that justify the disproportionate death of disabled and marginalized people through common sense notions that, quote, these people were unwell to begin with, end quote. Thus, when data scientists and visualization creators are implicated in eugenic visuality, this is not by any explicit drive to harm, but by the deployment of visual rhetorics which enable the implicit conviction that it is impossible to harm what is already unhealthy. For example, the disabled, aged, poor, and raced. In the following, I will be using the CDC COVID-19 data tracker as an exemplar. I will dissect eugenic visuality into specific practices, obstruction, obfuscation, and omission that produce meta-eugenic readings of public health data to legitimize eugenic policies. The way that the data tracker establishes public access to this data is through a series of separated panels, different links, and different tabs where you can choose which curated version of the data to see. So this data tracker is participating in eugenic visuality through the ways of seeing that are constructed and constrained by the numerous subdivisions of graphic categories and the presentation of trends divided by racial categories in the absence of contextualizing information such as regional infrastructure and the material realities of labor class. So these visualizations make it possible to believe that there is some kind of inherent racial difference in outcomes or cultural choice involved in the different outcomes without any understanding of how certain populations are actively deprived of access to healthcare and other forms of essential infrastructure. In an example that makes the historical implications clear, you can see a map at the CDC data tracker that shows chronic health conditions by US county, which is basically attempting to map where these people that were unwell to begin with live in the United States. If you look at this map, it's actually quite clear that the people that live in these areas that also have these conditions, this is the Black Belt and Appalachia. So these are places that have been historically and contemporarily intentionally deprived of healthcare infrastructure. I am arguing that these subdivisions produce data informatics that obstruct, obfuscate, and omit critical context that would meaningfully illustrate racism and ableism's central role in the embodied consequences of COVID-19 infection and death for racialized and disabled people. So these obstructive visual rhetorics detach population data from infrastructure data. They present the consequences of public health without any context. They enable shallow interpretations of the data that can implicate the most vulnerable people in their own deaths. And they perpetuate dominant biases against oppressed communities. One would have to flip through multiple maps and perform their own overlays to recognize trends that are driven by structural racism in policy and infrastructure, rather than by inherent racialized differences. This inability to overlay data and compare rate data to regional data in context represents the obstructive practice of eugenic visuality. In another example, the CDC data tracker shows vaccination rates of adults by age group, divided by those with and without disabilities. The bar chart also shows the proportion of respondents that probably or definitely will not get vaccinated. In this graph, disabled respondents show a higher rate of will not vaccinate. This phrasing is egregiously misleading, as many disabled people have been recommended not to vaccinate by their healthcare providers due to potential complications and contraindications with their medications and immune conditions. It is also possible that many disabled people in this category feel that it is unsafe for them to even leave their houses to get a vaccination. The visualization enables an interpretation that implicates disabled people in their own vulnerability. The graph makes it possible to believe the population most at risk from complications and death due to the COVID-19 infection also has disproportionately chosen not to get vaccinated, thus leading to interpretations that unvaccinated disabled people are responsible for their own heightened risk. This clouding of interpretation through questionable word choice represents the obfuscatory practice of eugenic visuality. Some other examples are you can't see comparative graphs of nursing home residents or prisoners to the general population. You can't see the infection and death rates of disabled people, only their vaccination rates. You also can't see that disabled people are vaccinated at a lower rate, but we can't see any information about how this is related to avoidance of medical spaces. And then, of course, the use of will not versus cannot. So obfuscatory visual rhetorics deploy language or other forms of visual rhetoric that is either imprecise or outright counterfactual to the detriment of people represented by the data. Finally, omissive visual rhetorics are taken up in the spaces of what and who is not reported. At the time of my initial search in October 21, there was no available data on incarcerated people and their rates of vaccination, infection, and death. The data tracker now has added a map with this data. However, a map of cumulative data for this population really represents a map of correctional facilities. Furthermore, though there are separate numbers for staff and resident cases and death, there's no sense of proportionality to indicate that staff had better care and resources once infected. They separate these categories, but they don't give you a sense of proportion in order to represent basically how disproportionately vulnerable the prisoners were compared to the guards. And although some studies have shown over 75% of vaccinated deaths occur in disabled people or people with 4 or more comorbidities, the CDC data tracker does not give data on how many deaths nationally are represented by disabled people. We cannot see the disproportionate impact this pandemic has had on the disabled and chronically ill, but we can see the disproportionate reluctance, will not versus cannot, of disabled people to get vaccinated. This omission makes it impossible to bear witness to how our pandemic response has resulted in mass disabled deaths and to fully grapple with this eugenic consequences of our actions. The absence of data representation in these critical contextual axes represents the eugenic visuality practice of omission. Now that I have thoroughly depressed you, I'm going to move on to what would it take to practice just visualities in data representation. Thema Monroe-White has an emancipatory data science framework. Sasha Costanza-Chalk outlines the design justice framework by the Allied Media Conference. And Sins Invalid have 10 principles of disability justice. And what I argue is that we can sort of align ourselves with multiple practices in order to shape more just relationships to data and visualization. And so from Thema Monroe-White's emancipatory data science framework, she calls for us to take stock of data harms. Basically, we must identify and acknowledge data harms before we can address them. And then data visualizations need to enable alternative futures. They need to enable us to imagine an alternative way of producing our socio-political formations. Principles from design justice and disability justice urge us to center the most impacted and to listen to their perspectives and experiences. And so I'm arguing that marginalized people need to have agency and authority over data interpretation and representation. They need to be able to have power over how these visual rhetorics are constructed about them. So it's not enough to simply wish to be a just data scientist. Justice is an ongoing practice of relation, and this is partly why I advocate for the engagement with multiple kinds of justice frameworks. Therefore, data science's implication in eugenic visuality is a symptom of data scientists' poor relation to disabled communities and communities of color. So I'm urging data scientists to build a future wherein the public has meaningful access to and control of the classifications and categories used to represent human life as data. Data representation take explicit account of the limitations of contemporary and historic data sets. This includes language descriptions of what the data and its visualization can and cannot tell us. Journalistic and social commentary on the meaning of these inherently limited representations must not make claims about a marginalized group without their consultation and editorial authority. Public health data about the pandemic would have a very different tone as told by the disabled and chronically ill people still living in a pandemic their able-bodied peers have moved on from. Data science and visualization take for granted societal norms that devalue disabled life. This devaluation is embedded in how data is collected, classified, and represented. Current approaches to COVID-19 data visualization deploy eugenic visuality, practices of data representation and interpretation that naturalize white supremacist logic. Bolstered by a sustaining cultural rhetoric of meta-eugenics, data representation supports and upholds eugenic public policies in response to crisis. I have shown how the CDC COVID-19 data tracker engages in visual practices of obstruction, obfuscation, and omission, producing data interpretations that devalue and dismiss the deaths of disabled people and people of color. Critical scholars and activists of race and disability, such as Thema Monroe-White, Sasha Costanza-Chalk, and Sins Invalid, produce a plurality of frameworks, principles, and ethical commitments from which data scientists might transform their discipline and produce the just visualities for just data futures.